call on Richard Leonard.
Thank you, Presiding Officer. It's clear that the Government's strategic framework, launched less than 2 months ago, was at the weekend abandoned. The decision to move every part of mainland Scotland to level 4 from Boxing Day for an indefinite period, meaning the closure of all hospitality, all pubs and restaurants, all non-essential retail, all public buildings, all gyms, all indoor tourism attractions, all museums and galleries for an indefinite period is a drastic move. And this time, 3 weeks does not sound like 3 weeks, but considerably longer. The First Minister has told us that this is a proportionate public health response given the virulence of the new strain of the virus. So will the First Minister also make a proportionate response in other ways? Will she step up government support for businesses, workers and families across Scotland directly affected by this government decision? Will the government step up levels of support for mental health and mental well-being services? And if the new strain of the virus is 70% more transmissible than the original virus, will the government urgently increase the number of daily tests carried out in Scotland by 70%, improve the capacity, utilisation and performance of Test and Protect by 70%? And will the First Minister commit today, as soon as it is practically possible, to a 70% acceleration in the rollout of the vaccination programme?
First Minister.
Presiding Officer, I hope people will forgive me. I'm, like many people across the country, probably feeling a bit overtired at the moment, but words almost fail me in response to that. I have to be perfectly honest. Firstly, and sorry, I should have given this answer partly in relation to Ruth Davidson, we have not abandoned the strategic framework. We will try to get back to a levels approach where we apply levels to different parts of the country depending on the prevalence of the virus as quickly as we possibly can. So we haven't abandoned our strategic approach. What we have done is not stand there static, clinging to an approach where we've got a train coming down the track that is going to run us over. We've decided to respond to the evidence that we have a new strain of the virus that none of us saw coming, none of us predicted that this would happen right now. And like all other parts of the UK, like other countries, right now Ireland has just decided stringent new measures, even although they don't yet have identified cases of this virus. We have decided to respond in a preventative, precautionary way in order to make sure that by the end of January we don't have a health service that has been overwhelmed, that we haven't run out of hospital beds and ICU beds. Instead, we have managed to ward this off and suppress the virus again. And I am so sorry that we are having to do this, but I would be even sorrier and people would have every right to be very, very angry at me if I didn't take this action and let the country just deal with the impact of what is coming down the track at us. So I will continue to try to take the difficult but necessary decisions to keep us as safe as I possibly can. So yes, we will continue to look at how we step up support. I said in my statement the Finance Secretary is already urgently looking at business support to see what more we can do. That will be true across a range of responsibilities. In terms of Richard Leonard's final 2 points, that, I'm afraid, is where words start to fail me. We have plenty of testing capacity. We are building up our testing capacity. These are not simple equations with about a virus being 70% more transmissible, meaning we need 70% more test capacity. The reason I can give some of the detail that I give every day right now is because we are testing so many people, and we will continue to make sure we've got that capacity. We're also rolling out lateral flow testing, although one of the things that we need to assure ourselves of is that lateral flow testing is sensitive enough in the face of this new strain. But on the vaccine, we will roll this vaccine out just as quickly as supplies allow us to do. You know, I cannot, and you know, nobody would love more than me to be able to magic vaccine supplies out of nowhere. I cannot do that, unfortunately. So we are working hard to make sure that as soon as the supplies come, we've got the supplies we expected from the Pfizer vaccine this year. Tens of thousands of people have already had their first dose of the vaccine. We're hoping that other vaccines will get approval in the UK shortly, and as soon as those supplies become available, we will get those vaccines to people and get those doses of vaccines into as many arms as we can. But we are dependent on the vaccine developers, the companies, the supply chains allowing us to do that, and I really would hope that Richard Leonard would understand that.